All right then, hi everybody, and welcome to this seminar, which is the second thematic seminar in the Future Resilience project called Uncertainty and Expertise in Public Policy, Navigating the Unknown. I'm Jörgen Sparv, and I'm one of the members in the project and representing NTNU Social Research in Trondheim, Norway. And I will give a short introduction to this seminar, and then we'll go on with some other agenda items. I will start by sharing some slides. Here we go. So today I will, like I said, I will introduce this webinar, and later in the program, we will have a Q&A session or a discussion, which will be led by my colleague, Evie Petrido. And the two presenters today are Arnaud Morrison from Sciences Po in Paris. We'll talk about experimenting with challenge-driven policies. And then Andrea Carlson will talk about control and uncontrol in pandemic crisis management. And after that, we will have a Q&A session. And I believe there is the opportunity to post questions if I remember correctly, but I will let Evie deal with that. We also have some prepared questions, of course. Before we start, however, I will talk a little bit about the project and then introduce the topic of uncertainty in just 5 minutes or so. So, like I said, this is the second thematic webinar of the Future Resilience project, which is a project that is funded by the European Commission through Horizon program. It's a 3-year project, and we are about halfway into it. It aims to strengthen European economic and social resilience. And the point is to use outputs and outcomes from other European projects that has to do with resilience in one way or the other, and package those policy instruments so they can be used in different events and emergencies and crises to foster resilience. And one of the key things in this project is so-called future resilience labs. They are in different locations throughout Europe, and in these labs we work with foresight and participative methodologies to tackle a range of challenges. And here you can see the 10 labs. They are in Spain, Greece, Bulgaria, Italy, Slovenia, Germany, Estonia, and Portugal, and one is also on the border between Germany and France. And these are defined by the local stakeholders, what they are dealing with, what the cases are about. I'm sorry, I seem to have shared the wrong slides. I apologize for that. Here we are. That's better. Let me just go back to show you where the locations are. Like I said, 10 different locations throughout Europe, and they are defined based on the needs and challenges in these local settings, so municipalities or local communities. And we work with different methodologies in these labs to foster resilience. And to this end, we have created 2 more tangible outputs in the project. The first one is a knowledge base which collects those outputs from other European projects that pertain to resilience in one way or the other, and it's open, so anybody can access them through the futureresilience.eu website. Under resources, you can go to this knowledge base and explore them. And the idea is then that policymakers and decision makers and stakeholders, they can use these policy instruments in facing different challenges because they are validated, they have been tested, and should work of course, they have to be adapted to the local context. And the second tangible output is a toolbox, which consists of methods for policy testing. And these are guidelines and supporting material to with a range of different methods like system mapping, weak signal and wildcard analysis, wind tunneling. You can see it on the slide, different examples. And there are also links to other policy testing and thematic tools in this toolbox. So combining this database with policy instruments and with the methods for policy testing is sort of the core of this project. You can, of course, go to the website and explore and learn more, but we are also very happy to involve you. So feel free to get in touch either through email or follow us on social media. We are very glad to have more people interested in this topic. Okay, that was just a few words to give you a background where these thematic webinars fit. And one of the very crucial thing about policymaking when it comes to crisis and disaster risks is uncertainty. And uncertainty is a really crucial concept, both theoretically and practically. And it refers to the lack of precise knowledge about future events or outcomes, and its presence often complicates decision-making processes. So in public policy, uncertainty is a pervasive challenge due to the complexity of societal systems and the unpredictable nature of external factors like economic shifts, technological change, and environmental phenomena. And in public policy, uncertainty shapes decision-making by requiring policymakers to account for unknown future directions and conditions. So, for example, in climate policy, uncertainty about future impacts can lead to more conservative, risk-averse strategies to mitigate potential damages. And similarly, public investment decisions are often debated over whether to adjust for uncertainty in the same way as private investments do, with some research arguing that governments are actually better equipped to handle uncertainty than private investors. Regardless, uncertainty forces public policy to be adaptable, as traditional models based on predictability often fail in the face of complex and unpredictable societal systems. So understanding different types of uncertainty is crucial in decision-making, in risk management, and problem solving. And I would like to just give some examples here. I found 11 different types of uncertainty in the literature, and some of them are overlapping and they can be debated, of course, but this is just to indicate what we're talking about when we talk about uncertainty. So for instance, aleatory uncertainty refers to randomness or variability in systems or processes, like, tossing a coin or rolling a dice. There is epistemic uncertainty, which is really about incomplete knowledge, when there's a lack of data or limitations in understanding. One example of that is, of course, new technology, because we don't really know what will happen. AI poses such an example. There is, of course, ontological uncertainty when there is unknown unknowns, unforeseen or novel uncertainties. Ambiguity can be argued is also an uncertainty where there are multiple interpretations or understandings of something. There can be uncertainty in model construction or in scenarios. There is, of course, decision uncertainty because we don't know what is the best course of action in a decision. Parameter and measurement has to do with input data into models that can predict future. There can be linguistic uncertainty. Certain words can be interpreted different or used differently, and resilience is an example of such an uncertainty. It can be defined in a very many different ways. And finally, behavioral uncertainty, because there's always unpredictability of human action. And this is just to give us a very brief introduction to the topic of uncertainty. And in this seminar now, we will hear about more specific, let's say, empirical aspects of this. And I will leave over to Arnaud Morrison from Sciences Po with that. And I hope you can share your slides. Otherwise, I will do it for you. And here we go. Yeah, Arnaud will talk about experimenting with challenge-driven policy for about 50 minutes, and then we'll leave over to André. And with that, over to you, Arnaud.
All right, thanks so much, Jürgen, for this introduction. Thanks so much also for your invitation. Very happy to be here. So my name is Arnaud Morrison. I'm an adjunct professor at Sciences Po in Paris, so doing research, but also working in the policy sphere. I work as a thematic expert for Smarter Europe at Intra-Europe Policy Learning Platform. And I've been told that there are many policymakers around the table. So I will look specifically into policy issues. And I will also present Intra-Europe, so you get a good overview of what I do at Intra-Europe Policy Learning Platform. So the title of this short presentation is to experimenting with challenge-driven policy. So we look at what is policy experimentation and how can we make good, better policy-driven policies. So a little bit of an introduction on Intra-Europe. So Intra-Europe is a very unique program in the EU because it covers all cohesion priorities, so smart, green, connected, social citizen, and also governance. It covers all European countries and all European regions. And we also have 7 new countries in the partner countries in the program. We have Ukraine, Moldova, and the Balkan, but we also have Switzerland and Norway in the program. And what Interact Europe does, it's really about improving regional development policy. It's really about a capacity building program, and the way we do it is through the exchange of experience, knowledge, and expertise. Is dedicated to policymakers, and is very different from the other Interacts, which are also doing some investment in infrastructures. Here is all about capacity building in policies. So the goal is to deliver better policies. And the way they do it, we have 2 actions. The first one is about the projects. So you have different regions across the EU and above working on specific policy issues. So it can be resilience, as we talk, or even uncertainty in policy. And they work together for a few years, exchanging knowledge and trying to make policy improvement. And the second action is the policy learning platform. And what we do at the policy learning platform, we capitalize on all the knowledge of all the projects, and we diffuse this knowledge to as many policy makers as possible. What we do, so at the policy learning platform, we provide access to knowledge. So we write very nice policy briefs. This one was on regional missions, and here we advocate for regions to pursue mini missions rather than the big missions like reducing CO2 emissions by 2050, but more like very concrete challenges, very local, place-based challenges rather than the big one. We provide access to expertise, and I will present what we can offer, like peer reviews and matchmaking. And we provide access to people. We organize workshops, but also webinars. on many different topics. So I recommend you to have a look at all the different activities that we can offer to policymakers. So one of our, let's say, gold service is the policy learning, the peer review from the policy learning platform. So we've been conducting many peer reviews across Europe, as you can see here on the map, more than 75 peer reviews. So it's a very good, very targeted, very concrete tool that regions can use. It's completely free. It's dedicated to public authorities. So whether you're local authority or regional authority, you can access for free to our service. You have a specific policy challenge, can be on any topic of the cohesion priorities regarding to your policies that you have in your region. What we do, we will bring peers from across Europe to work with you for 2 days on this policy challenge. So the first day is about learning from one another, and the second day the peers and you will work on providing you with specific concrete policy recommendations to address your policy challenges. So 2 days, very concrete, very targeted. So we are doing one, for instance, in 2 weeks. It's going to be in Region Heide, and they have this gigafactory of batteries coming in the region. So it will transform completely the region. So it's about trying to understand how to pilot this transformation through a new governance arrangement. We also have matchmaking. Matchmaking is only 2 hours, so it's like mini peer reviews. So instead of 2 days, it's 2 hours, but still it's online, and we discuss your policy challenge, and we bring some experts and peers from across Europe to discuss the challenge and to provide you with some good policy recommendation. So let's move on into the topic of today's webinar, working on challenge-driven policies. We see in the policy world there is this shift from the view of innovation is only for competitiveness to policies for innovation must also respond to regional and societal challenges. So we see that innovation is not only something for driving growth, economic growth and competitiveness, but it has to be this kind of intermediate step towards the long-term goals of fostering sustainability and inclusiveness. So here, innovation policies, it's much more complex because it's not just about saying which policies do we need, but also trying to understand where are we going. So this issue of directionality, what future do we want? But also this issue of legitimacy. Why do we want this future, and who is going to define this future? And also this issue of responsibility. So transformation by and for whom. So we have like this policy concepts when we talk of challenge-driven policies, trying to respond to specific societal challenges that are also quite complex for policymakers. When we discuss challenge-driven policies, it's about experimentation. We policymakers, we must experiment with new policies to try to stimulate this social technical transition. So innovation policies has also to bring institutional social challenges, social innovation when changing the directionality of existing research, development, innovation activities. All right, and policy experimentation is a key component of challenge-driven innovation policies. And here the European Commission is telling regions you have to start working and experimenting with new policies to promote, of course, the green and digital twin transition. When we talk about policy experimentation, it's really about testing new policies on a small scale, having some key performance indicators to measure the impact, and learning from the results before scaling up those solutions. So there is a new framework, let's say, the European Commission to drive the process of policy experimentation. There is, for instance, at the regional level, the Partnership for Regional Innovation from GRC, trying to drive policy experimentation, but also there is this policy experimentation project, trying to integrate more policy experimentation into EU research and innovation policy making. So when we think about policy experimentation, also what we can say is that regions and municipalities, they are great for policy experimentation because they are very flexible. They have the right size to pilot new innovation policies, to tackle very concrete local issues, also involving the stakeholders and communities. So they make the ideal space, let's say, for policy experiment. But of course, it's very complex. When engaging in policy experimentation, you require some risk taking and, of course, the involvement of entrepreneurial-minded entities and also policy entrepreneurs. So you have to work with your policy entrepreneurs within your regions. Also, why policy experimentation? Because when we talk about challenge-driven innovation policies, it's about addressing societal challenges. Societal issues are very complex. They are kind of wicked problems. And they have those three type of issues. There is this issue of contestation. So we are not sure what is the best approach, what is the best solution for these big problems. There is this issue of complexity. What are we going to do first? We can do many things to address the issue, but what is the most important to prioritize? And then there is this issue of uncertainty that was introduced by Jürgen, where technology is going to lead us. We don't know if it's the good solution or not. So here, policy experimentation is a good way to start thinking about addressing those big societal challenges without taking so much risk, because we don't engage everything and all the different innovation to tackle these wicked problems. When we look at policy experimentation, there is, of course, many issues. And one of the issues when we look at the local level, at the regional, local level, municipal level, we see like this kind of dualism. For policy experimentation, we require some flexibility in the policy making. It requires the public sectors to take some risk. Also the right to fail, right of failure. It requires also to have at the institutional level some sort of entrepreneurial entities. And what you presented with sort of living labs that you're proposing, I think is quite interesting. And also it requires to have some policy entrepreneurs. So the individuals trying to drive changes in the policies. But then you have this issue of compliance culture within the public sector. There's, like public scrutiny, media, they say avoiding mistakes and failures. There's this institutional inertia, trying to always doing the same thing over and over. So how to experiment when there is this kind of institutional inertia within the system. So how to empower collaboration for innovation? One key component is to have sort of entrepreneurially minded public-private organization. What you presented with can be policy labs, open platforms, learning networks, or living labs, in order to institutionalize this process of experimenting with new policies, having new pilots, and so on. So very important to have those type of structures, to have the right to fail when doing new pilots and policies. Also, one key issue that is very important in policy experimentation is, to acknowledge that experiment can fail, but in order to justify this failure and justifying public spending, it requires different aspects. one crucial aspect is to ensure accountability in the process. So make sure that you have this accountability in the process, not in the solution. It's also finding the right timing and sizing windows of opportunity. When we discuss also using those type of intermediaries with the capacity to act and the legitimacy in the system. Always maintain very concrete aspects to address local challenges and be as inclusive as possible. Also having those right partnership with the private sectors to distribute the risk and to share this accountability. Highlighting always the public benefits when engaging with private partners, and also having those monitoring aspects with key performance indicators. So to give you some more concrete example of some challenge-driven policies, and you can have access to them also through the policy learning platform. This is one of the good practice, and I think it's quite interesting. He's here, the city of Sofia, through this intermediary organization called Sofia Development Association that was created by the municipality of Sofia. What they've been doing is they started to experiment with challenge-driven hackathons, working at kind of mini missions to solve local societal challenges like traffic, air pollution, green aspect of the city, and so on. So they've been working on organizing many different hackathons. So here is 20 hackathons. And at the end of those hackathons, the students or the researcher presenting the solution, they win a prize money. But also there is public procurement of innovation in the next phase, where they first pilot the solution within the city. If the pilot is successful, there's going to scale the pilot through public procurement of innovation. So this is a very interesting way of solving local challenges, and you can see there is also like this Demola good practice. I'm sure you've heard about it, is to connect business challenges with students. So that's one good practice from Interreg Europe. Another one, and this comes from my research, and it's going to be an article that is going to be published very soon, is in Lugano, in Switzerland. They've been launching the Lugano Plan B, which is very interesting, is supporting shops, local shops to accept Bitcoin as payback. So you can go to McDonald's, for instance, and pay McDonald's in Bitcoin. So they've been trying to promote using blockchain and cryptocurrencies, and especially Bitcoin in the city, not only as digital payment, but also they want to become this blockchain capital of Europe. So also doing training with the banks, working with the students, with the different stakeholders to promote the adoption of Bitcoins. But of course, why this experimentation is very interesting is that it's very controversial. So it's a very controversial innovation. Many people, they are completely against Bitcoin because it's very bad for the environment, it's very useless and so on. But some people are very in favor of Bitcoin because it's secrecy, decentralized, and so on. So it has also raised a lot of criticism among the media, among the politicians. But here, what was key in driving this experimentation was the political leadership. So very strong political leadership to drive this experimentation. Also, the role of intermediary organizations to support piloting different cryptocurrency for the shops in Lugano. So they had like this living lab working as a kind of intermediary to promote digital solutions. And then they've been doing a lot of public-private partnerships with different actors in the blockchain. Also, one thing that was very interesting to learn is that the reputation of Lugano is not so good because there is in Lugano a lot of grey money. So let's say people from Italy, they didn't want the money to be taxed. They go to Lugano in the banks. You know, so there was this issue of reputation that make them, let's say, more prone to accept those type of controversies within the system. So experimentation, you know, sometimes going to be very controversial because you're experimenting some new aspect of innovation. You are going to have criticism, but it's very important to have this political leadership to drive these changes. And that's it from me. Thanks so much for listening. You can reach me at my emails here, and I would love to have some questions from you. So please raise your hand, or you can ask questions in the chat. Thanks so much.
Thank you. Thank you so much, Arnaud, for this very interesting insight into Interreg Europe. We will have a discussion afterwards. So without further ado, I leave over to Andre. Your 15 minutes.
Yeah, thank you. You can hear me. Yeah.
Yes.
Yeah. I will start my clock.
Excellent.
Yeah. Yeah, thank you for the invitation and the opportunity to present my work, which I will try to share in a second. There, you can see it?
Yeah.
Okay, let's get it. Okay.
We are still in the PowerPoint software. There you go.
So, yeah, my name is Andre, and I work as a PhD student. Well, I'm actually finishing up quite soon, and I work at NTNU Social Research. So I will introduce more about myself later. So my PhD is about pandemic preparedness and how to respond to it. So the plan for today, what I'm going to present is just kind of introduction to the problem of pandemic management. And then I will just present some of the empirical findings on the different problems that I think are related some way to at least uncertainty, and some of it is probably also linked to policy making. And then I will have a summary. So my way into this project was an interest that I worked previously with the civil security, societal safety, security, threat assessments, and finally I worked at national level with COVID-19 crisis management. So that is kind of my backdrop for this presentation. To introduce the problem, I don't think you really have to tell anyone how problematic our pandemic is, but some of the largest problems is that it forces like different policy domains and different areas of society to intersect, and they require them to interact with each other when they normally in non-crisis can work within their own kind of structure. Previously, there has been kind of 100 or 50 years between each pandemic, but this is increasing. So now we see kind of a new pandemic every 10 years. So I think it's about 5 years to the next one. And the cost of a pandemic is kind of immeasurable, but someone told me how much that is, but I will say that it is 18 to 15% of the world GDP. That is how much the COVID-19 pandemic has cost the world. And of course, now when we see maybe this kind of long COVID kind of illnesses, then this cost will increase by large amounts. So that is one part of it. And you can ask yourself, why is pandemics becoming more common? It is a lot of different factors, but it's at least it's overpopulation. We get older age. There are more humanitarian emergencies. International travel then helps. And of course, the absent or ineffective health and surveillance systems contribute to being unable to kind of both monitor and also register where it breaks out. So a paper from 2021 did a mathematical modeling and said that you are 38% likely to experience a new pandemic on the scale of COVID-19 in your lifetime. But they also warn that this percentage will double if you do not learn from COVID-19. So to understand my PhD and what I have investigated, it is the crisis management or the pandemic management of the COVID-19 pandemic in Norway. So the main actors that I will focus on is the Institute of Public Health, the Norwegian Directorate, and the National Treatment Service of Cybernetic Medicine, and also the Ministry of Health and Health Services. So the point is, the main point is this problem is not going away, and the challenges I'm going to present will continue to persist if we do not learn how to manage them in the next pandemic in maybe 5 years. So I can try to move on. Let's see. Yeah, so the first kind of problem is to agree on a set level of risk. So the structure of when a novel virus emerges is that there are different mechanisms for monitoring it, and this is both at local levels, at regional, national, and international levels. So the point or the optimal route is that international data is shared. This was problematic during the COVID-19 because China didn't want to share the data. So optimally, this data should have been shared with the World Health Organization and the Center for Disease Control and so on. Then these actors analyze it and they compare it with each other. And in Norway, it was the institute that did this kind of assessment and the risk and did the modeling of pandemic. So the first risk report that came in January, they said that COVID-19 has a low risk. And they said that about 100 infected will be in Norway by Easter 2020. So both the Directorate and the Cybernetic Center, they disagreed about how dangerous it was. And they even said that following the logic of the institute would be a self-fulfilling prophecy of destroying the health services. The Prime Minister, in an interview, she blames the institute for the mismanagement of the pandemic. And she said it was because they created a false sense of security when they said there would be only 100 infected by Easter. But the institute also highlighted the very high degrees of uncertainty of their modeling. So kind of my way into investigating this is to ask what is kind of this disagreements really about? Because if they agree kind of the risk, but they disagree about how dangerous it is. And I was interested in understanding how is that actually possible. So one of the first disagreements from January was it was unclear who and to how many the pandemic would affect. So I'm not going to read all these interview transcripts. We can circle back if you have questions. But the main point here is that there was kind of this idea that the pandemic would not be a problem for the Western world. It would only be a problem for the developing countries. Another problem was that they didn't share the data. China didn't share the data. They said officially that it's about 1% of the population will be infected. It is kind of like the influenza. But the caseworkers and those seeing what was happening saw that China built a lot of new field hospitals. They had to create a lot more somatic beds. And they also saw, for example, that some bridges were blown up and kind of they laminated different buildings in concrete to avoid infection. And that is not normal for influenza management. So there was a large skepticism toward the data coming from China in January. So the point here is that, and it's kind of an obvious point, but the quality of the healthcare system will influence how dangerous the pandemic is. So I will come back to why that is important. So in February, March, a new problem arrived. It was unclear how the health services would tolerate high infection rates. So the second risk report highlighted Italy as a case because there were a lot of tourism between Norway and Italy. And at the same time, Italy was experiencing the collapse of their health service. They wrote a report of this and they circulated it between the political leadership in the European countries. So when the Institute sent a draft of a third risk report, the Directorate and the political level opposed it strongly. And if you read kind of like the internal emails that circulated, it was quite harsh language also. So they referred to the experiences from Northern Italy and said this is the richest, one of the richest and best health and care services in the world, and they are collapsing now. So on one side, the political leadership and the Directorate opposed the modeling. On the other hand, the Institute opposed the proposed management strategies. So they, for example, did not think that we would be closing schools. They did not think about restriction of work. They did not believe in isolation of people in geographic areas. So all these kind of things that actually were implemented in the end, they were opposed. So this trend of the directorate proposing measures and the institute opposing them, they continued in a lot of different disagreements. And then I think it was 8th of March, the ministry, like the grown-up, had to come and say, you have to get closer to each other in your communication. And after that, the disagreements and conflicts continued behind closed doors. So to fully understand the risk, we need to assess our imagined ability to manage it. So that is kind of the problem with China. You didn't know if they had like one hospital, then a few infected would overwhelm their services. But if they have 100 hospitals, then it means that the pandemic is it has quite a higher risk. So how you're able to manage a risk influence actually how large the risk is. So in March, kind of you get a lot of data, you get more knowledge, but there's still an element of uncertainty. So in March, one of the biggest challenges was it was unclear how to make decisions in crisis settings. And I think they even, so there was kind of a small conflict between Norway and Sweden. And Tegnell said that Norway is doing an experiment on their population. And the health minister actually agreed with this, but they said it's not an experiment. What we do is learn and lean on new knowledge and assessment from countries that have been through this wave of infection. And also the director of health, the kind of the crisis manager in the beginning, he said that the data from the science and the knowledge based only gave half of the answer. So over the span of these 3 first months, it was clear that there were many different interpretations of the situation. And it seems to be at the core of this, I think, is kind of a skepticism towards using science in situations that are characterized by high degrees of uncertainty. So then we move on, we take action, we have enough knowledge, we need to do something. So the first thing we did was to close down Norway. So what was kind of the sentiment, or what was kind of central for closing down Norway, was some feeling of losing control over the situation. However, to me, it has been kind of challenging to understand what is the situation, because the situation is kind of everything. And I am left with kind of this, they just tell of a feeling and a sense of being pushed against the wall. So it's hard also for the interviewers to describe what it is that goes out of control. But I like the last interview here. If the spread is too large, parts of your option will be lost. If you bicycle down a hill with bad brakes and the speed becomes too high, in the end you have the choice between driving in the ditch or clinging to the bike. We thought it was better to make quick decisions and rather correct afterwards. So you drive into the ditch to avoid the consequences at a later time. After the close down, there was kind of this continued disagreement between the institute and the directorate, and also there came this very important report from the Imperial College that outlined 2 different management logics. One was the mitigation strategy, and one was the suppression strategy. So the suppression strategy was the one that was done in Norway, and the mitigation was the one that was done in Sweden and Great Britain and other countries. So the point here is that pandemic management should be careful to lean too much on expert knowledge in crisis settings. By no means that it is unimportant, but you should not only base your decisions on expert knowledge. And recently there was published a paper by Gardell where she goes through the Swedish case and actually explains that if you set experts as crisis managers, you will have mismanagement of a crisis. So it's quite critiqueful of the Swedish management. And I think the health minister summarized it well. He says it was the idea that you could press the curve down and keep the infection at a level which meant that you balance the measures against a certain level of infection, while at the same time the capacity of the health services was not exceeded. It gradually became clear to us that this balance act could not succeed. Society is not a fine-tuned mechanism where you can just adjust the switch to precisely hold the line. The risk of holding this line would be too great. We will lose and overwhelm the healthcare services, which in turn would lead to a reaction with further reinforced measures that would actually be stricter than those you needed to suppress the virus and keep the control over the infection to begin with. So I think I think I'm pretty much on time. So to summarize some of this, if you're trying to figure out the risk of a virus, it is not only related to the biological traits of the virus. It is also trying to understand the quality of the health services in the outbreak country. We need to better understand the role of experts and academics in crisis settings and why their predictions and decisions seem to be more askew than non-experts and laypeople. That is kind of important if you want to have knowledge-based management of crisis. The understanding of infections as something gradually developing created kind of the false sense of security, making decision makers think that there were more time to actually prepare and scale up the response. So this is kind of a lack of worst case thinking. Another point is that it seems that traditional risk assessments are not equipped to correctly assess the threats because they lack this kind of systematic way of including an assessment of the ability to control the risk. And this leads to an underestimation of the risk. And then when faced with crisis settings, decision makers, non-academics, seem to make decisions that delay the onset of consequence. And I have not investigated this in further detail, but when I have talked with people that kind of work in first-line emergency services, this is very intuitive to them. They do this often. So it's kind of interesting to see the same kind of reaction pattern also at national levels. Yeah, that's it. Questions or feedback, or yeah, and this is my contact info.
Excellent. Thank you so much, André, and for this insight into the COVID management in Norway and the research that you are doing into this matter. Now let's move on to the last agenda item, which is a discussion, and this will be led by Evangelia Petrido at NTNU Social Research. Over to you.
Thanks, Jørgen. Thanks, André, Arnaud, for two great presentations. And I will say here that even though they seem to be very different, there is some points of convergence. For example, you both talked about experimentation, and I think in a very different, maybe in a very different light. And also both of these policies, innovation and economic development, or regional development rather, and crisis management specifically in the health sector, both involve technical aspects. And of course, all the other political aspects of public policy, which are always present in such situations. So we have about 10 minutes. I have like tons of questions for you. We could sit here and talk all day, but we cannot do that. So I would like to start with Arnaud, and of course our favorite subject, policy entrepreneurs, right? But let's not talk about that now. What I would like to ask you is, how do we go beyond experimentation, Arnaud? What are the preconditions for successful upscaling of policies? How do we go about doing that?
Thanks, Evie. That's a very good question, and that's a big issue. I mean, we see experimentation in many Horizon projects, right? Many Horizon Europe projects, they are experimenting with new policies, with new pilots, with new approaches. But when the project ends, the experimentation ends as well. So how do we go next? I think one of the, and that's a huge issue because many pilots could be upscale and become more into processes and benefit society as a whole. I think there is this issue of political leadership. There is very important leadership in the processes. I mean, we see, like when I took the example of Lugano, when they're trying to promote this very controversial innovation of Bitcoin to use as a digital currency for shops, we see that political leadership here was key. I mean, in the EU is very different because we have a multi-level type of governance system. And here, I think the pilot must align with what higher level are promoting. So there must be alignments in policies in order to have this successful upscaling. Otherwise, I mean, there will be a lot of criticism if it's only done at the local scale, and if the pilot is a little bit controversial, because I mean, all pilots are a little bit controversial when we think about it, because it's public money. And you know, there will always be some people saying, well, you're doing solar panel, this is useless technology, we should do something else. So this idea of how to respond to wicked challenges, you know, that's will always have some controversies to it. So it's about political leadership and multi-level alignment with higher level of governance. So if you have like those two, this will be great for scaling up some experimentation.
And you touched upon this, my just a quick follow-up question about, because I thought it was really interesting that you had a controversial policy. Because, you know, sometimes if it's something technical that it doesn't have high costs, you're thinking, sure, okay. But that Bitcoin can be also controversial. Of course, bike lanes can be controversial as well. But I mean, does policy experimentation come at a cost? And if so, what kind of cost do you think?
Yeah, when we try to answer to societal challenges, I mean, what was discussed by Andre, there's uncertainty, there's contestation, there's many different type of issues. So it's difficult to tell whether you will have like the right solution with experimentation, but at the same time, this cost that you generate, you also generate a lot of learnings that maybe not will be, maybe the key performance indicators, the monitoring system will not find it like, you know, right into the data. But let's say like the example I showed with the challenge-driven hackathons in Sofia, where they were trying to respond to those local challenges. It was also a process. And it was a process that made the politicians who were present during this process to understand the importance of policy experimentation. So yes, it's going to be a cost in public funding. Yes, there might be some failure attached to it, but at the end of the day, it's a process that will make different stakeholders, politicians, also understand the importance of the process of experimenting with new policy, as long as they are involved in the process, of course.
Of course, yeah. Thanks, Arno. This was great, and I think it ties into then. If I can move this question to Andre, where, if I understand you correctly from your presentation, experimentation did not have, or rather, was it negative? Was it positive? If we talk about experimentation in this crisis management situation.
Well, I guess it was kind of a bit contingent on what kind of system you had beforehand. So if you had a faulty kind of management system beforehand, then you actually have to experiment. You can't use it. So, but there were other nations that had kind of more well-functioning health system that probably shouldn't experiment too much, but keep to what worked. So I guess it's kind of twofold answer, both yes and no. So I think that experimentation is kind of, it might even be a part of the crisis definition, because you have to do something new if what you have doesn't work. So at least in Norway, it's about positive experimentation.
I see, and it seems like the stakes are higher when it's actually a experimentation that it's sort of live.
Yeah.
we have a question from Martin. So let's see if we can take that. I'm not sure what the microphone settings are, but Martin, go ahead if we can hear you, or if you can write in the chat.
Yeah, my question is really, you referred to this, the pandemic response, and say that the experts wouldn't be the best to manage the crisis necessarily. But on the other hand, we have this big problem with optimism bias, like that we all suffer from, and one should think that experts somehow maybe could relieve ourselves from that optimism bias. I think we see it a lot also in climate change, right? Where there's a cost associated with doing something. I think in your case, you referred to the fact that there's, tourism coming from Italy and so forth. So when there's this, the cost of action comes into play. And particularly when you talk about, I'm a futurist, when we talk about future crisis, there's a heuristic, the availability heuristic at play, which means that if you don't have available data from the past, and in the sense of COVID, we have a simulation heuristics in the sense that we could simulate earlier instances that looked like it. We actually knew that there was the Spanish flu, but when we hadn't experienced, none of us were alive to have experienced something that was similar to the event. And so we stray towards the optimism bias. We hope that it doesn't happen, and then our policies go the similar direction. And I think we basically see the same with the climate change. So could you touch upon how do we tackle this optimism bias, both on the side of people? We all suffer personal cost if we were to actually do something about climate change. But also from a societal perspective, we suffer something right now for benefit that others will receive later, and not necessarily ourselves. So there's like several problems here. How do we tackle
I think I have an answer for that, because it kind of so in an optimal world, maybe then you would have kind of this technical. So if you are predicting future crisis, then it's more of kind of like a risk assessment of the future. So to take that one first. So you need to kind of have, I think I touched upon it. You have to have this ability to also assess, well, if the risk occurs, how good will we be to actually manage it? Because then you can say something about worst case scenarios, and you can kind of pop the bubble of the optimism. You can say, well, but we do not have the equipment to actually manage this kind of risk. So in a paper I'm trying to write, I call it like a second order risk assessment. So we have this first kind of risk assessment that is quite technical and says something about probabilities and consequences. When this is kind of presented in a risk matrix, you probably should take out these risks that are in the red and ask yourself, okay, if this happened, how do we manage it? And then that is kind of maybe more like a vulnerability assessment. So I guess for being able to understand actually how we will manage it and to decrease kind of the optimism, you can do that. It's a question of control. And I think Jens Rasmussen, if you were familiar with his work, Jens Rasmussen in 1997 wrote a paper that's called Risk Modeling in a Dynamic Society that says the exact same thing. So that is that one. And in crisis management, when you're in the situation, kind of the focus shift, because a pandemic is both risk management and crisis management. So there are kind of flare-ups that has to be managed right away, and there are also management of consequences maybe 20 years in time. So that is kind of, to me, that is a lot more challenging, how to avoid this kind of optimism bias in the crisis management, because that is, as you say, that is the main findings, that you were reluctant to actually model these worst case scenarios.
All right. Thanks, everyone. Unfortunately, our time is up. For those of you who came to listen to us, thank you so much. Arnaud, thank you so much for great presentations, and I will invite everyone who participated. If you have any questions, contact us at Future Resilience or Andre or Arnaud individually. Thank you so much.
Thank
Have
you
a
so
great
much.
day. Thanks.
Bye
Bye-bye.
bye.